Food and food quality and what we are feeding our children is like one of the primary determinants of why kids are getting sick.
I work with many practitioners that a child has an autism diagnosis. You work on their diet, you improve their exercise, you improve their sleep, and they lose that diagnosis 5 years later.
In some studies for children, up to 70% of antibiotics are inappropriately prescribed. We know that antibiotics are the single biggest acute disruptor, this immediate disruption to their developing microbiome.
But we have to understand that food and food quality and what we are feeding our children and what they become accustomed to eating is like one of the primary determinants of why kids are getting sick. What we are understanding, you mentioned obesity, we understand now more so than ever before that the chemical load, right? And we can name many different chemicals, whether it's preservatives, additives, high fructose corn syrup, just high sugar in general, the oils, all of these things independently have been linked to obesity. And what's happening is many of the food sources for our children, and this is across socioeconomic, barriers. This is for everyone, inner city to burbs, all across the board. The majority of the food that our children are eating, especially when they leave our home, right? So if you have young children, they leave the home for school and for birthday parties and for different events. If you have middle schoolers, they're hanging out with their friends and doing sleepovers. If you have high schoolers, oh, wow, they're independent. They're pulling into the local fast food and doing whatever they want, or they're pumping Celsius and all these other drinks in. But the load, the cumulative load of these independent toxins that have all been tracked and linked to obesity is what's making our kids incredibly sick. It's driving up cortisol. It's driving up insulin. It's driving the metabolic pathway towards more storage of visceral fat. And that in turn, over a period of time, then impacts hormones, right? So what we're seeing on the hormone front is all this chemistry is happening, right? From probably a newborn period all the way through, early elementary to mid-elementary timeframe. Then what we're seeing all of that do is throw people into patterns of estrogenization, right? Which is where even boys are having higher expression of more estrogen-like symptoms. And when we in our practice go and measure it, you can measure an estradiol and you can measure an estrone, which is a storage form of estrogen. Yeah. Those levels are high in boys, So boys are getting estrogenized. Girls are also getting estrogenized. So they're going into puberty earlier and earlier. Yeah. And they're also getting androgenized, meaning they're getting a lot more sort of male derivatives of hormones floating around in their system because of this liver load. That's essentially the why of why it's happening. So we hit age 8, 9, 10. We've got, girls going into puberty earlier and earlier. We have boys getting more estrogen-like symptoms. I don't know if you've been to the beach recently. You'll see boys, young boys that have man boobs and all these other things, bellies, all of these things, developing. And then as we move on with that, we see sort of then the disorders associated with that, right? So the androgenization of girls is leading to an epidemic of PCOS, POTS, which is another disorder that we're seeing more and more of, things like MCAS, which is an autoimmune disease that has to do with histamine loads. And in the boys, we're seeing things like declining sperm counts over time, and then definitely the mental health component as well. So it's all this continuum that the first place is food quality, but then the second place, I think, is what's happening to the liver and the load of toxins impacting the liver. And the two of those things together are now impacting, what you see expressed in the exam room.
Right. And what we might neglect to see is, okay, so we see these issues. Yeah, okay, my child started puberty a little early, or my kid is carrying some extra fat, and they're kind of venturing into childhood obesity, but it's okay. It's just it is what it is, and not understanding that early puberty is now setting her up for higher risk of Alzheimer's, right? Higher rates of dementia, issues with menopause. That is getting set sooner. Everything else is potentially coming sooner as a result. And even mentioning that androgen load too, it's really interesting. I'm so glad you brought this up. This aromatization process, where our diet, again, with boys and our testosterone, our free testosterone, getting aromatized
Yep.
and converted into estrogen. And with women, it can be the opposite because of the liver, as you just mentioned. And we can get some kind of upregulation with testosterone levels. And it's just creating this like hormonal chaos in our kids' bodies.
Definitely. There's hormone chaos, there's gut chaos, right? You have both things happening kind of simultaneously. And both of those factors, we have a third factor. I would say I always think in triangles. You know, when I'm talking to patients, I'm always drawing these triangles and trying to show them like, what are the three things that are, you know, at play here? And then the third is our culture and our environment. We have an epidemic of stress, and it's coming from a couple of different places. So I'm lumping it into this one word, but it probably needs to be divided out. One place where we experience stress is our exposure to blue light. And I think our exposure to blue light creates a chronic high cortisol level in the body for all of us. Kids to adults, seniors, everybody. So that's one level of stress. The other level of stress is just family dynamics, right? We have a lot of fractured families. We have lost our sense of community. Kids and the structure of how they run their lives today, it's very, I don't know about yours, but I look at mine and I look back and I look forward and I look at younger moms too. There's this rhythm of like just one activity to the next, driving around town. There's kind of a lack of just like free play. We're not letting kids go outside for some some areas it's just simply not safe. But this undercurrent of stress for lots of different reasons is creating this high cortisol, sort of environment, in the environment of a crashing gut, in the environment of hormones. So take all of that. It's happening over a period of time, right? And then move it year by year as your children now enter into puberty and adolescence. And now you have just honestly a shit show, right? Their brains are on fire. Puberty was always hard. Adolescence was always hard. We always had rebels. You always had people doing high risk behaviors, right? But they're not just doing high risk behaviors now, they're crashing and burning. There's anxiety at an unprecedented level. There's ADHD. There is addiction and eating disorders. We are seeing all these things go up and our kids increasingly at risk. We're finding that the happy, joyful kid is starting to disappear from our landscape, and that's who we could turn to for innocence and for, pure joy that wasn't tainted by like the pressures of the world. We're not seeing that as much anymore. That's starting to go away. And I think it's going away because all three of these factors are at play. And for every child or teenager that I see, I'm always trying to figure out which of these three, are having the greatest weight in this particular moment.
Right. And that's the importance of the individual child and paying attention to the individual, because it's going to be different from person to person,
very much,
adult to adult, child to child. And I want to go back because you mentioned something earlier. You mentioned these different factors, and we're going to touch on diet really quickly.
Yeah.
Of these newly invented chemicals. Many of these can fall under the category of obesogens or carcinogens, but just really alter our biochemistry in potentially negative ways. And they might be studied in isolation from time to time, but we're not studying the entourage effect.
We're not.
Like what happens when all these things come together in one Twinkie?
Right.
You know what I mean?
Right.
Like we're not looking at this. And again, we're just seeing the outcome like, this is just normal. We've normalized what's happening with this dysfunction of our bodies. And, and you mentioned this crazy phenomenon of like, when you said free play, like that sounds so good to me, just being able to go outside and to be free and just to play with my friends. And we had video games too. Yeah. All right. Yeah. And I remember spending hours playing video games from time to time. Right. But it's more like in certain pockets. And also, but the video gaming, even then for me, was like inclusive of my friends, my little brother.
Not in isolation.
And I'm wondering like what happened along the way. And I don't think it was just the fact that the games got more addictive. Like we have video game designers who are doing certain things to make you keep playing that video game. Like, and you don't think about that. Very different from Pong, with Atari and his little,
I remember that.
You could play it with your friend for maybe 30 minutes. You're like, all right, let's go ride our bikes. That's enough. But now it's like endless, it's just kind of that FOMO. It's like a FOMO in video game form, right? But you couple that with the lower level of energy that we might have. You couple that with what you shared there, part of that triangle, is the separation of family and structure, and also our community structure, and just having friends outside, or our cousins or whatever in our neighborhood, just to go outside and play. You know, we've really distanced ourselves physically as far as like our community setting, but also because we're tuning to these devices. The device is the
community, unfortunately, right now, you know, and, you know, I feel like children, you know, I love that schools are now, you know, sort of clamping down on the whole cell phone policy. I don't know if you've seen some of that recently, but most schools are now, you have to check your phone in and lock it up, and you can't have it in the classroom. But that's just this year. And I have a junior and a sophomore. But you know, I feel like that's become everyone's community, is your phone, you know, or your device, whatever device you have. And unfortunately, you know, there's another fallout to that, which indirectly impacts their mental health. It's hard to make social connection, like, you know, like not being able, you know, to simply say hi, goodbye, good morning, how are you? Lacking empathy, you know, lacking basic social skills is something that I think our children are suffering from. And what we're seeing it is in the most recent generation coming up, where they are rejecting family. They don't want family, many of them, you know, they're like, I need alone time or downtime with my phone, you know, and that phone or that device has become sort of the soother, you know, rather than a human being or another person or another community member. So I think, you know, we're shifting culture. We have shifting, you know, sort of food and food quality. We have a higher toxic load. And then we've got this hormonal thing going on that we have to really start screening kids for earlier and earlier to prep them. And I almost feel like, you know, I wrote The Hormone Shift and we talked about that last time, but I feel like it applies to our children because they need a plan before they enter middle school, you know, in terms of what their risks are, what their gut health is doing, what their liver health is doing, what nutrients they may lack, where are they with their social media addiction and cell phone and blue light sort of exposure. And then parents need a plan, a very sort of organized tactical plan of this is where you guys need to focus with your kids. And unfortunately, because we're not having those conversations, I feel like you're having parents work against each other. Like, you know, like, well, why is that person letting this one do that? Or why is that parent so crazy? All this is fine, you know, that type of thing. So I feel like we need standardization. Like, this is what it looks like to be healthy. These are the markers to check. This is how you prep and this is how you plan, you know.
Yeah. And this speaks to, we don't need to wait around to implement certain things.
No.
And you have this great power plan that you utilize specifically for kids. So let's unpack that.
Definitely. So I think this is an acronym that I've used, right? In terms of, you know, just trying to help parents with where you begin. And a lot of it is starting with diet, like start with protein, make sure they're eating every 3 to 4 hours, getting enough protein at every meal or snack. That's one way to keep blood sugar stable. That's one way to stop their sugar cravings and their salt cravings and their junk food cravings, for sure. I think the other is really looking at the concentration of healthy fats that they're getting in. So are they getting in the right amount of fats, and the right kind and quality of fats in their diet? So the omega-3 fats in particular, the omega-9 fats, we know that those help to decrease inflammation. I think teaching them from an early age, you know, to really move towards staying hydrated and drinking water. And then once they hit the teenage years, which is where I am right now, it becomes a little bit of a challenge with keeping them off the sodas and the Celsius and some of those type of things. But I think constantly educating them, right? I think parents get super frustrated because, you know, they feel like they're not getting heard, but they are listening. So the more you say it and the more you try to model good behaviors, the better. I think, you know, helping them understand what brings them energy, you know, what energizes them, having them always learn to read their own energy, you know, what is energizing them, what is depleting them. I think that's really important too. And then from a dietary standpoint, getting fiber. So that's like a very like actionable, you know, these are things you can do no matter how old your child is.
I mean, first of all, just look at the statistics, right? We're seeing about 40-50% of kids with a chronic disease, more than that with adults. And so we really need to get back to basics. I mean, if we're moving in the wrong direction, if life expectancy is going down, then that means that we're doing something wrong, and that's our modern lifestyle. If we're not mindful of what we're doing and we don't take ownership and start to figure out exactly what's going on, then we're never going to change anything. And then every kid's going to have a chronic disease. And as a parent, If I have 2 children, I don't want one of those 2 kids to have a chronic disease, but that's what's happening today. Like that's what we're seeing. And it shouldn't be that way. And it wasn't that way 20, 50 years ago. It was like 5, 10% just a few years ago. So it is something that we're doing, or probably many things that we're doing. And if we begin to take ownership of the things that we do have some control over, then I am sure that we can move things in a better direction. And families see that all the time.
Yeah. And that's one of the things that is really sobering for us as parents that you shared, is that we're inching towards about 50% of our kids now having some form of a chronic illness. And this isn't just like 10% more. This is like significantly higher rates than it used to be. Like you said, 5, 10% back in the day. And specifically, you've been sharing statistics on much higher rates of things like autism, autoimmune conditions, really the list goes on and on. There's been an explosion in obesity rates. Can you talk a little bit about, again, mentioning that our modern lifestyle is a disaster for pediatrics? What is it about our lifestyle in particular with things like allergies and eczema and asthma and other autoimmune conditions? What's causing these higher rates?
Well, I think to start with, the most frustrating thing is that we don't know, right? We don't know. We're not putting this as a serious priority, and we're not studying this to the level that I think we need to be, because we're not identifying it as that issue. We're saying it's better testing, it's genetics, it's just the way that it is. So we don't have the perfect framework. We don't have a full understanding of the picture. But I think personally, the big contributing factors are our poor diets. So we're not getting the nutrients that we need. And then we're also getting too many chemicals. So we're surrounded by chemicals. There's chemicals in our food. We're just being bathed in a soup of chemicals, and we're not getting the nutrients that we need. So how do we expect our kids to grow up and function optimally? Their immune systems are not functioning optimally. They're getting to a point where they're so inflamed that it turns into a chronic disease. And again, when we say, oh, it's just genetics, it's just the way that it is, we're just better at diagnosis. It's not true, because there are so many kids that come into integrative practitioners, and you work on their diet, you improve their exercise, you improve their sleep, you clean up their home environment and get rid of the toxins, and they get better. They lose the diagnosis. I've worked with many practitioners that a child has an autism diagnosis, and they lose that diagnosis 5 years later. They have an autoimmune condition. They go back to their doctor, and the numbers all look normal. And the doctor says, well, what did you do? How is this possible? And it's because they change up their lifestyle. Now, does that mean that there aren't any genetic components? No, of course there are. Right? Some things, you could do everything in the world and you're still going to have that condition, but you can still improve your life. And I think about it like diabetes. It's a perfect example. We have, type 1 and type 2 diabetes. And with type 2 diabetes, we know that if you improve your lifestyle, things can get better, right? If you improve, you increase your exercise, you eat a little bit better, then a lot of individuals will lose their diagnosis and get back to a better place, but not necessarily as much with type 1. Certainly you can improve things, but it's a genetic component. I think a lot of autoimmune conditions are like that. Yeah. And even autism, I think that it's a diagnosis based on symptoms. And so I think it's a lot of things. And for a certain portion of the population, a certain portion of individuals with autism or autoimmune conditions, there is so much that we can do and so much that we have done that's given us this diagnosis, but that means that there is a power that we have to make a change. And if we don't say that we have some power, if we just kind of push it off and say it's better diagnosis, we're not going to help those kids. And, definitely get into discussions, and anytime we talk about autism, it gets heated, right? Mm-hmm. Certainly does. And if you mention this, then people get upset. But there are around 40% of kids with autism now that are nonverbal. We would not have missed that 50 years ago, right? Where are those diagnoses? So sure, there's such a wide range when you're talking about autism and symptoms, and there are so many families that are struggling, so many kids that are struggling in their own bodies. And if there is something that we can do to help those kids, then why would we not want to explore that? It's not to shame anybody. It's not to say that we don't love these kids or we shouldn't treat them amazingly. But it's, why are we not trying to help these families that need the help? If you don't want it, that's okay. That's totally fine. But there are so many families that do, and there's a lot that we can do.
Yeah. I think just having more education and more examples of what's possible, like you just mentioned, being able to put these conditions that are becoming, again, they've gone up precipitously into remission, those stories getting highlighted. Whereas what we're really inundated with are more stories on how it's just getting worse and worse, and there's nothing you can do about it.
Right.
Right. And so just being able to reframe this, to know that, and I love that you said this as well, just about any of these conditions can be improved, right? We're not just talking about complete remission. We're just talking about people getting better. And what are some of those factors for us to actually stack conditions in our kids' favor? A big part of this, and also just being able to spend time with you, to read your book, and just to spend time in your world, is removing the cause, like removing some of the glaring issues. Like, again, you start off by saying, we don't know exactly what it is with all these things. We know that the environment itself has changed dramatically. And there are multiple things in our environment that are stacking conditions, in particular against our kids. And so one of those that you highlighted, and by the way, everybody should be following you on social media too. And one of the things you highlighted recently is the impact that a high sugar diet has on the developing brain. Let's talk a little bit about that.
Yeah. I mean, if you look at the data on sugar, we eat more sugar in some meals than we should be eating in the whole week. We eat more sugar in the first few years than adults ate their whole life, even 20, 30, 50 years ago. And that's not to say that we can't have any natural sugars, but we're having so much artificial sugar, and it's added to everything. And I can just speak as a parent, right? I can speak to seeing my own child. Well, I have two kids now, but the older one has been, old enough to actually see this. And they go, he goes to a party, he eats one piece of cake, and he's a different kid because we don't eat that at home. We don't add any sugar except for natural sugars to anything that he's had. He's 4 years old and he never really had it. He doesn't eat any of those processed foods. But if he does eat a little bit, he's a completely different kid. And I've always thought this my whole life, but then you actually see it in your own child. You see the difference from just one meal at a birthday party or something like that. Then what is going on in the other kids' brains that eat this food all of the time? And how much of that is, when we talk about ADHD or we talk about behavioral issues, how much of that is actually just from the diet, that if you clean that up, you would see a huge difference? It's not to say, again, that there isn't ADHD or their medications can't be useful sometime, but how much of it is actually controllable just from changing our diet and just from adjusting our lifestyles, that we can see a huge difference. And I'm an integrated pediatrician, and to me, what that means is balancing the best of modern Western medicine with alternative practices. I'm not against Western medicine at all. And sometimes when we talk about integrative, it's woo-woo, it's out there, and there can be some people that do that. But why does there have to be two sides, right? Why does there have to be modern medicine and alternative medicine? Why can't we just do whatever's best on the day for our kids? And why would we not want to decrease a medication if we can do that? It doesn't mean we should never prescribe it, right? Sometimes an antibiotic can save your life. Sometimes the child does need a medication to function optimally. But if we can adjust their diet or remove some toxins, and that decreases their medication, that gets them off their medication, that gets rid of their diagnosis, why would we not try that? Like, there's no downside to that. And it's like it's these two sides fighting back and forth that are really on the same team. I mean, aren't we all on the same team? Don't we just want healthy kids? And yes, we have some different opinions maybe on how we get there, but at the end of the day, we want the same thing. We're all on the same team.
Yeah.
Right. And medicine, it seems like, has moved into this world of telling people what to do, which is so frustrating, again, because we're on the same team and we're trying to help people to get to a better place. And doctor comes from the word docere, meaning to teach, right, in Latin. And that's what medicine always was. But it seems these days like we're just telling people what to do instead of coming together and creating a plan that works the best for the family. Yeah. Right. And that's one of the impetuses for the book, too. It's like everybody's different. Every situation is different. And we need to look at all the evidence, figure out what makes sense for that family, and help them to get to a better place. But not to tell them what to do. It's just to teach them what's out there and let the parents, the family, decide what's best for their kid.
Right. That's another one of the most empowering things about your work and about the book, is you keep bringing us back to this important fact, which is we as parents are the most important people in our child's health. We are the ones who are primarily responsible for our child's health, but we have a system that has been created in our culture that has caused us to really outsource a lot of things.
Mm-hmm.
And the system itself is really medicalized a lot of symptoms that we start to lose our own parental inquiry about, like what can be causing this. And also our practitioners, same thing, just having a little bit more inquiry instead of just treating symptoms and targeting symptoms. But your work is really about removing root causes. And also, yes, whenever we have an acute situation, medicine is there to help with those symptoms as well. We can have both. And that's really the great thing about this, is that it's a both and world, you know. But most importantly, it has to be empowering for us as parents. We have to take that responsibility, because we have the responsibility to pay attention to our child's uniqueness, and understand there isn't any cookie cutter way to parent and to care for our child's health. And you're giving us some of these tools. And just staying on this topic of sugar, for example, if parents are wanting to do a little bit better, because it's a tricky landscape, you know, we grew up in a sugar culture. All right. We grew up in a very, very just kind of inundated with a lot of sugary products. You know, it was not uncommon for me to wake up and to have a bowl of Lucky Charms, or the off-brand kind of cereal, you know. So instead of Lucky Charms, it would be like Fortunate Rabbit's Foot or something like that. You know, so I was just making that name up, but it'd be like an off-brand kind, you know. And for lunch, having a pizza, you know, a slice of pizza, you know, with a juice. And then for dinner, you know, having some macaroni and cheese and fish sticks, and maybe some canned green beans are thrown in the mix, right? So this would be a normal day of eating for me. Not to mention the chips and the cakes.
Sure, me too.
And the cookies. And my drink of choice, my beverage of choice was like juice, right? Quote, juice, which had 0% juice, by the way.
100% sugar.
Yeah, 100% sugar, right? And so if parents are wanting to make some shifts in how much sugar their kids are eating, and here's my question for you, because parents are like, but my kid wants it though. My kid wants it. What do you say to help coach that parent?
I totally get that. And I say to parents that it's our job to be the parents, and sugar is addictive, and it's not something that we need in the levels that we're eating. And it's certainly not in the added sugars that we're getting and the processed sugars that we're getting. So at some point, we just have to take charge of our family's health, and we have to make decisions that are best for their long-term health. And so, I tell people, if in my office, blame me, it's fine. If that's what you want to do. But I think at the end of the day, the number one thing that people can do is just start to read labels. And it doesn't mean that you have to never give them a piece of cake. It doesn't mean that you have to go from a bag of chips to broccoli, and that's going to be the only thing you're going to feed your kids. But every parent can start to become savvy at reading labels. And if you take ownership when you go to the store and you purchase things that you're going to turn over that bag and you're going to read the label, hopefully you pick some things that don't have labels, but for the most part, if we're talking about, let's say a bag of chips is going to have a label, and pick the things with ingredients that you actually know what they are. If it's a long chemical name, it's probably not good for you. You don't need a PhD in chemistry to know that some long word on a label is probably not that good for you. And if they have, 10 grams of sugar is not as good as, 5 grams of sugar, right? You can look at that and kind of compare the two, and it doesn't have to be more expensive. Sometimes it is, but it doesn't have to be. And you can pick the better version. And if you do that for every single purchase over the next 5, 10, 15 years, it adds up. It makes a huge difference. And it's the small little decisions that we make that add up that we're just not focused on these days, because we're so focused on convenience. We're so focused on money and, buying things that are cheaper. And I get that. I understand that we want to do what we need to do, and we have to do what we need to do. But at the same time, if we look at our health, 50% of kids have a chronic disease. So if you're okay with that, then you keep living the same way that we are in America and Western culture right now. But if you want to have healthy kids, then you have to look at the stats, and they are what they are. That's not doom and gloom. That's not me trying to scare people. It's just saying, this is what it is, and I want you to be healthy. And if you want to be healthy, then there are some things that you're going to have to do differently than what we're doing these days, or you're going to be one of those statistics. And that's just is what it is. And it's very frustrating as a doctor that we're not pushing the conversation back towards health and to the very little things that parents can do, because it matters. Like, and there was a great study out of Harvard where they were looking at soup. I don't know if you know the cans of soup study, but they took canned soup and they were looking at BPA levels in these patients. They gave them 5 days of canned soup, 5 days of homemade soup, and looked at the BPA levels in their urine, because in the lining of the cans there's a BPA, and it was 1,000% difference after 5 days. And I love that study because it's such a simple little study, but at the same time, we're like 5 days, cans of soup versus homemade soup, 1,000% difference BPA. Like, what does that mean for every single decision that we're making? It's you don't think about it, but you just making a few more meals, it adds up.
Yeah, I love that. And by the way, that study, I cited that study in my previous book, in Eat Smarter. And why does this matter? Well, we'll put these studies up for everybody to see right now. Right now, we've got solid data. This just came out this year, finding these, BPA, these plasticizer chemicals, in particular, those that come from things like plastic water bottles and food products, showing up in human hearts. Like half of the patients who were tested had it in their carotid artery plaque, showing up in human testicles, right? And so again,
all of them, every testicle,
every testicle tested had plastics in them. Okay, like it's integrating itself into our tissue. Also, another study found that it's integrating itself into skin and leading to high rates of skin cancer. Like, we started this off, and my question was about our environment and how this environment is really cultivating a very complicated terrain for our children in particular, because they're growing up in this at such a high level. And so here's the directive that you shared for everybody. Not just, let's pay attention to those labels, and let's do better to avoid added sugars, right? We're not villainizing all sugar. Like, certain foods are going to have sugar in it, naturally occurring. A little bit of added sugar is we don't want to beat ourselves up about. And from time to time, kids go to birthday parties, all this stuff. But let's do our best to avoid added sugars. And this was a revolutionary idea that you said, which might sound crazy. Let's eat more stuff that doesn't have a label on it. This is not to say we don't DoorDash. All right. But it's just like,
but how much? How often?
Exactly.
And can we not aim to encourage people to cook more? I mean, you're a foodie. It tastes better when you make it. It tastes better when it's fresh. If you pick something off a plant and you eat it, I mean, I challenge anybody, go out to a farm, pick a tomato off of a plant, pick a grapefruit off of a plant, eat anything off of a tree, a plant. It is 10 times better if you eat it right then. You cannot get the same food that is packaged in a store that you can get when it's fresh. And that's usually the best case scenario for us, is just cooking the food from the source. But even then, if you go and you pick a berry off of a bush, how long does it last for? It lasts for 2, 3, maybe 4 or 5 days. So what is being sprayed on all of our food, even in the best case scenario, when it's shipped from another country, goes in a boat or on a train or wherever it gets here, or in a truck, then it sits in a warehouse, then it goes to a store, then it sits in the store, then you pick it up, then you eat it. That's not 3 or 4 days. So something's happening, something's being sprayed on basically everything that we eat to preserve it. And so these chemicals just keep adding up. But if you're not even eating that, if you're eating the prepackaged food that has all the stuff sprayed in there and put in there and to keep it as a preservative, then how do we expect to be healthy? How do we expect our kids to be healthy if that's what they're eating every single day, and they're not eating the best case scenario food? They're eating the food that's packaged, sugars, dyes, chemicals, things that are not allowed in other countries that we're just eating every single day. And then we wonder why we have a 50% chronic disease rate. We wonder why obesity is going up. It's not rocket science to be that there is a huge portion of it that's very controllable. And going back to what you said, it's the family, the parents that have to take control. The medical system is not going to do it. Medical system is very slow to change, and medicine is fantastic at identifying things that are serious conditions, but it's not set up, and it has never been set up for chronic disease. And there just isn't the time in most medical offices to spend 30 minutes talking about your nutrition, spend 20 minutes talking about the toxins, dive into all of these things. You're going to spend 3 to 5 minutes with the doctor. There's no bad pediatricians out there, right? These are people that went into medicine to help kids, but there is a system that we're working in that's not set up for chronic disease, and not set up to look at root cause, and not set up to talk about what we're eating. And so, okay, here's a medicine, here's a pill. It does make you feel better in the short term, but it solves nothing. It solves nothing. Doesn't mean that a medicine can't help you, and sometimes we need it. But that's not the reason that so many kids are sick. They don't have a deficiency of a medicine. They have a deficiency of nutrients and vitamins and too many toxins. And if we're finding, BPA in everybody's testicles, well, what about the other 10,000 chemicals that are out there, and how much of those are in our bodies? And then what do we expect to happen when we're filled with all these chemicals? So if we're not doing everything we can to minimize that, then we're going to see the results that we're seeing.
And as an integrated pediatrician, I do write prescriptions for antibiotics. It's not that it's a never ever. It's just that we know in some studies for children, up to 70% of antibiotics are inappropriately prescribed. Oftentimes for things like viruses that, of course, antibiotics don't do a thing for. And we are now heading to the point where if we are not good antibiotic stewards as parents, as adults, as physicians, as public health professionals, we are in 2050 possibly headed to a point where antibiotic resistance is going to become a leading cause of death worldwide. I mean, that is frightening, where none of the existing antibiotics will be able to help. And so that's on a broader public health level. On an individual level, because as a pediatrician, I look at this little child in front of me or this teenager in front of me, we know that antibiotics are the single biggest acute disruptor, this immediate disruption to their developing microbiome. And our infants' microbiomes and our teenagers' microbiomes are rapidly changing and affecting how their immune system is developing, how their brains are developing. So with antibiotics, yes, we want to use them appropriately. Although some of the statistics, when you look at, and I always back up here and say, as a mom and as a pediatrician, both of my children received antibiotics when they were babies, right? I mean, my daughter, she was 2 to 3 weeks old and she had a urinary tract infection. My son at 5 weeks of age had strep. In fact, he had this really, strep discharge coming from his ear. I'm not going to mess with that. Those were necessary antibiotics. And yet we know for infants who receive antibiotics within the first 6 months of life, they are at an increased risk for almost every single allergic disorder, including eczema, asthma, hay fever, anaphylactic food allergies by the time they're 4.
You shared, I think, 2 to 4 times higher incidence of developing these issues.
That's right. And then, we look at the gut-brain connection and we see antibiotics at any point in life, but especially in infancy, in that first 6 months of life, can increase and almost double the risk of mental health concerns by the time your child is an older kid or a teenager. And the more rounds of antibiotics, the higher the risk. And so when we understand that, we need to understand when to use antibiotics appropriately. And then B, when we do use appropriate antibiotics or inappropriate, we need to understand the disruption to the microbiome and do what we know how to do to restore their microbiome so that it doesn't have this ripple effect on their immune system or their metabolic system or their nervous system, either in the immediate or later on in life. I mean, even when they're adults, this can have that ripple effect.
I love that you said this again. It's such a valuable asset that we have when we have the use of antibiotics, life-saving in certain contexts. It's just the overuse.
Yep.
And, unfortunately, we have a system to where also we might be as patients coming in, just want to get our kids something.
Yes.
And, as you just mentioned, having the overuse of this could lead to a situation, and what's already trending towards that, where antibiotic resistant infections are going to be a leading cause of death. We don't want to get that far. We've got to make a change right now. You talked about your training in basically coming in to taking an offensive approach and attacking if somebody's experiencing a symptom or a condition, and not necessarily understanding downstream. We might even hide the fire. Number one, the fire still might be brewing, and also potentially causing issues elsewhere in the body.
That's right.
And that's really the thing I want to ask you about, is looking at, again, the whole person, because we might not think that antibiotic use might be connected to some mental health issues later on down the line.
Yeah, well, and what you said is so right on. We're often in conventional medicine, we start a medication for a symptom, right? And then another symptom arises. So we start another medicine, and then another side effect arises, and we start another medicine. And eventually you have kids and adults who are on this kind of polypharmacy of medications. And at that point, then we can't separate out, is it that their condition isn't getting better and they need a new medicine? Or is it that they're having all of these side effects that may be either additive or sometimes even synergistic, and they can, really interfere? And so I see this with our teenagers where if we are not aware of all the factors that can contribute to microbiome disruption, we may be inadvertently, as you said, kind of fanning the fires of inflammation and disease without recognizing what we're doing. And so it's time to step back and realize your teenage girl who maybe gets put on the birth control pill because she has horrible period cramps, right? Takes ibuprofen for those horrible period cramps, has a little anxiety brewing, so she's put on an SSRI medication, right? Maybe has a history of eczema, so she's lathering on steroid creams, right? And maybe has some reflux, right? So is on antacid medications, or allergies and is on Zyrtec. All of those medications in combination. Oh, and let's not forget the low-dose antibiotics for acne, right? All of those medications can disrupt the gut microbiome. And some of those, we don't think about other non-antibiotic medications often as disrupting the gut microbiome. But some of them, like ibuprofen, can disrupt the microbiome as much as an antibiotic. So we have to be aware of all these things that we're doing to try to support this child in front of us in the best way we think we're doing. And yet, if we could step back and say, look, okay, if they need to be on an SSRI at the moment, okay, let's do that and recognize that we don't support her gut-brain connection. First, she's not really ever going to probably get off of that medication. Second, we're not getting to that root where we're saying, look, let's heal from the inside out. Let's nourish her neurotransmitters, how her brain is thinking and feeling and acting and all of that. Same thing goes for little kids, right? I mean, we have little kids infants who are fussy, maybe they're, spitting up, and that happens to coincide at the same time. Recognizing that all babies have some amount of reflux. They don't all have reflux disease, but once Zantac became approved for infants, this was back in the early 2000s, all of a sudden, every baby is being diagnosed with reflux disease and being put on Zantac in the first 6 weeks of life, 8 weeks of life, instead of saying, hey, look, we know that the microbiomes of really fussy infants look different. They have higher inflammatory markers. There's a difference in their microbiota. So how about restoring a healthier microbial balance in their gut so that they don't have the fussiness and don't have the antacid medication that then can disrupt long-term, increase the risk for, we know disruption in those early stages can increase the risk for obesity, diabetes, metabolic syndrome, heart disease, all the things that now on the other end of life, we're trying to combat and counter.
Yeah. Before we get into the microbiome deeper, let's start more upstream with the tonsils, because you had a really great insight about this in the book, and this connection between the tonsils and the immune system, and also the tonsils and a similarity with the gastrointestinal tract and our gut. Can you talk a little bit about the role of the tonsils and the connection with the immune system?
Yeah. So, a lot of people think, oh, the tonsils are just, especially when I was growing up, everyone had them removed, right? It was like the Brady Bunch, right? Everyone had their tonsils removed. Yep. And, they're this kind of, this extra thing that we don't need anymore. But when we think about our tonsils, they are lymph tissue. And as part of our lymphatic system, they're a really essential part of sensing our outside world, communicating with our immune cells, what's friend or foe, how am I going to react? And they're and when we think about it, they are the start of our GI tract. We are one long hollow tube, from the mouth all the way down at the bottom where the poop comes out. And these tonsils, we have these similar tonsil-like patches called gut-associated lymphoid tissue lining our entire GI tract. And that makes up like 80% of our immune system. And some people have heard the saying that our skin is our largest organ. Well, our intestines, our GI tract is our largest interface with our outside world because, again, we're hollow, right? So any food we're ingesting, any microbe that we're encountering, any environmental toxin has to pass through our GI tract. And the way our tonsils and our GALT, our gut-associated lymphoid tissue, interacts with those things will tell our immune system, hey, that's okay. We'll just let it pass. Or, that's a broken down amino acid. We're fine with that, right? Or it might say, oh, okay, there's a virus going through that or a bacteria that I don't really like. Our immune system, hey, immune system, kick in. Let's create a little bit of inflammation to kick it out. If though we get bombarded, our immune system continues to get bombarded inappropriately, eventually our gut immune system kind of crosstalk can happen inappropriately. And then sometimes we start attacking our own cells. And that's what happens with autoimmunity. So we can see, just how important these are for our developing immune system. Now, the tonsils. So, I write the story about my own son, right? He had huge tonsils. They're called kissing tonsils. It sounds cute, but it's not, right? They're literally kissing the back of your throat. And so when he was about 3 or 4, his tonsils were just getting bigger and bigger. And he had obstructive apnea from it, right? Now, there are indications to remove tonsils. However, we have to think, all right, well, tonsils are part of our immune system. Why is my child's immune system acting up? What is the reason? Is it from environmental allergies? Is it from some chronic infections that are kind of trapped in your tonsils? Is it from food allergies or sensitivities? What's going on? Because if we can identify those and remove those sources of immune stress and inflammation, a lot of times the tonsils can shrink and the adenoids can shrink, and we may be able to avoid removing them.
Now, this is such a huge insight right now that I got from you reading your book. All right, so we've got our tonsils as this kind of frontline sensor for our immune system, and it can be hyperreactive. And of course, we're looking at it. This is just an obstruction. You don't need it, just remove it. Instead of understanding it's responding, it's reacting to something, and not realizing that your gut lining has a similar reactive tissue that you can't see, though. Not like tonsils, right? And so that inflammatory response is happening elsewhere in the body. You just can't see it. And it might manifest as allergies. It might manifest as Crohn's disease. It might manifest as depression, right? Because one of the other things that you talked about, which a lot of parents would say, okay, my kid doesn't have any gut issues.
That's right. Yeah.
Right. And you address that, because if you don't have a blatant thing like belly aches, some type of gastrointestinal disease, we might not realize that, as Hippocrates said thousands of years ago, all disease begins in the gut, but also all health begins in the gut as well. And so being proactive at, okay, I understand you might not have specific like belly related symptoms that you're seeing, but you said with your patients, you always start in the gut either way.
Always start with the gut. And so, if kids are older, or, parents are in the room and I start talking about, hey, let's do some detective work. We got to think about what's happening in your gut, because, all the effects it can have on the rest of your body. And a lot of times the answer, the refrain is, well, yeah, but there's nothing wrong with my gut. Poops are perfect logs, no tummy aches, no heartburn, no constipation or diarrhea. And then we have to step back and really talk about, why the microbiome is so important for, as you said, if your microbiome is inflamed or there's an imbalance there, disruption there, you might not have any, quote, tummy or digestive symptoms, but you may have some itchy skin, right? Or you may have really bad acne, right? Or you may just not be able to focus as well on your school play lines. Whatever it is, all the things that kids may be struggling with and have as their goals, right? We can tie virtually all of them back to, hey, let's take a look at your microbiome. Those trillions and trillions of microscopic, tiny little friends in your belly. If they're not happy, you're not going to be happy. If they're not healthy, you're not going to be in optimal health. And that's why we always start with the gut. whether it's a poop test or not. I mean, I love to do poop tests, when I can, because I can't tell just by looking at you, what's going to grow inside your stool and what's going to be there. But we can also suspect, hey, look, if there's something going on with you from a mental health standpoint, from an immune standpoint, from an endocrine hormone standpoint, metabolic standpoint, we have to look at the gut first. If we want their gut microbiome to be in the healthiest state possible, that's where we have to go back to the foundations, right? We have to go back to what is going to nourish your child's microbiome, because again, they're not just like tomato seeds. You grow and you leave and come back in a month and you have these beautiful tomato plants. No, you need the right amount of water. You need the right amount of nutrients in the soil. You need the right amount of sunshine. You want to talk to them, give them the right amount of love, right? And so we need to think about our microbiome in the same way. And once we have those foundations, that is when we have true microbiome resilience. That is when, even if your kids need an antibiotic later on in life, or even if they get exposed to whatever microbiome disruptor, their microbiomes can bounce right back, because our microbiomes want to go back to the state they were in before the disruption. That's really important. So you get a good foundation. All right, they take a little hit. Fine. Get right back up and restore the foundation really easily.
Yeah. Resilience is one of the most important aspects of health. It's that bounce back factor. And I love that so much. And actually, you talk about these creating microbiome magic with our kids and what they're doing every day. There's 5 specific things. And this is, again, about that foundation and creating resilience. And you kick things off talking about the importance of nourishment, right? The right nutrients, the right environment, the right soil that it's going to create. And if you could, what are 2 or 3 things that we should be looking at to do for our kids for microbiome nourishment?
So, and with nourishment, I put into 2 parts. There's what we want to try to get in, but for some families, if as you write in your book, right, if the culture hasn't been quite shifted just yet, and it's a harder sell to get in like a huge salad, at dinner time. All right. Sometimes the biggest shift can happen by knowing what to keep out. So there's sort of 2 parts. And as a parent, right, we're all busy. We're trying to do the best by our kids. You pick the thing that's easier. Right? I mean, we want those small wins. And as you get those small wins for you and your child, and everyone starts to feel better, it gets so much easier. And here's the thing, once you know what to take out of your diet too, it can change your palate so that then it's more acceptable, more desirable to get in the things that we want. So what are the 3 things we want to get in? From a microbiome centric standpoint, I call them our microbiome champions. The 3 F's are fiber, our phytonutrients, which I know is a PH, but it sounds like an F.
Still got a F.
Yeah, it's still got a F. and fermented foods. So those 3 things, if we can get in, right? And we know, fiber, here's the thing that, and why, I love everything you write, because they may sound simple, but you know what? Simple is often the hardest thing to do, right? Simple is not always easy, and yet simple and the foundations are what are going to get you the longest lasting health results. I want to make it so that no kid ever has to biohack in their 50s, right? It's like, what? Let's just make healthy living a lifestyle, right? And so what do we get in? Well, fiber, we know that 95% of Americans today don't get the recommended fiber intake. And the recommended fiber intake, varies on age and sex, but let's say it's about 25 grams of fiber for most kids. Well, the Hadza people down in Tanzania, which has, they're still a very traditional hunter-gatherer society with the richest gut microbiome of virtually any population in the world. They eat somewhere up to 100 to 150 grams of fiber in a day. So doesn't seem like it should be that hard, except that our diets are so full of ultra-processed junk that have like 0 fiber in them, that it's not easy to see why most of our kids aren't getting enough fiber in their diets. And I make it really concrete. I give lists, like a cup of raspberries is going to be about 9 grams of fiber. All right, that's your a third of the way there to your daily fiber intake, right? My kids could down a whole tray of raspberries if I let them, right? And then, a cup of lentils is going to be maybe 16 grams of added fiber right there. So just, trying to make it concrete, figuring out like where can we get in a little fiber here and there. And then phytonutrients, that's a color. The phytonutrients, all of these phytochemicals. I prefer the term phytonutrients because phytochemicals just doesn't sound right, when we're talking about plants. But these phytonutrients, every single color has a different benefit for our eyes or our heart or our brain or for our immune system. And every single color also acts as a prebiotic. And every single color also affects how our microbial genes express themselves and influence our epigenetics. And we know 8 in 10 kids and adults have a phytonutrient gap in every single color, right? Yeah. And so if we think about, eating that rainbow, it sounds so cliche, but, for kids, if they're not eating a whole rainbow, well, then think about, broccoli. A lot of kids like broccoli, right? Well, getting the green broccoli and the purple broccoli, that counts, right? Same broccoli. It's not even the same broccoli. It tastes a little different, right? Bell peppers, you love them? Great. Get the red, orange, purple, green. All of those, right? It's a different phytonutrient. So you can fill in their color gap even just like that. And then I always talk about fermented foods because that's probably the hardest sell for a lot of kids and grownups because they're thinking, the sour, the sauerkraut. I grew up with kimchi, so it's like second nature to me, right? But there's so many ways we can get fermented foods in. And honestly, one of the best ways, make it with your kids. In my daughter's 3rd, 4th grade combined class, there are these 8 to 10-year-olds, and I created the 6-week curriculum for them. It was honestly one of the most fun and rewarding things I've ever done in my entire life. And, we talked all about their, the tiny friends in their tummies and how they help them, what they do, and how do we nourish them, with food and lifestyle. And we made sauerkraut. We brewed kombucha, and we had the 2 ferment stages. So on the second stage, the kids got to choose different flavors and we seasoned them up, and we had a little kombucha tasting contest. We made fermented lemonade, which is one of the recipes I have in the book, because these are easy ways to get fermented foods in and have kids make them and want them. I had parents calling me saying, "Oh my gosh, I can't believe, Emily actually took a bite of sauerkraut. She's like the piggiest thing ever." And she said, "You know what? That wasn't too bad." She still don't want a huge bowl full, but that's where we get kids. If they, first of all, understand, we have to give our kids way more credit than most of us do. They can understand why their microbiome is important to them at virtually any age, right? And we can empower them with the tools to know how to do it for themselves. Then that's our job as parents, right? Setting them up to be successful, not just, from an academic or career standpoint, but how do we help them be successful from a health standpoint, for long term?
Hey, if you like this video, make sure to check out this video right here.
The parental ego comes because of the traditional parenting paradigm, which trains us parents to think that we are the almighty. We have supreme control and we get to dictate our children's lives. So when we come from that mindset, every time our children then disobey us, we are set up to believe that that is defiance and that needs to be punished.